pre-syncope, which is this, they may feel weak, feel they're going to black out, but not actually lose consciousness.
And what causes syncope?
There's many causes of syncope. One of the causes of syncope that we frequently deal with is called vasovagal syncope. It has many names: vasodepressor syncope, cardioinhibitory syncope. What happens with these patients is that their blood pressure drops, their pulse drops, they get pale, cold, clammy, sweaty, and they feel as if they're going to black out. When the episode resolves, they may feel extremely weak after the episode, feel like they have to go to the bathroom to urinate or defecate, and even feel somewhat somnolent or sleepy after the episode.
And how can I avoid it if I were to have a syncopal episode?
Well, the best thing to do is to have what's called a symptom diary. When the patient writes down under what conditions it happened. Did it happen after a meal? Did I have alcohol before the meal? Did it happen when I smoked a cigar too fast? Did it happen when they drew my blood? So you have a general idea of when it's going to happen. And then when you know when it's going to happen and when it's likely to happen, you can do whatever is possible to avoid those situations.
Such as?
Well, I'll give you a good example. I have some patients who have a big meal, so they distend their bowel. Then they have a drink or a couple of drinks. Alcohol stimulates the vasovagal system. Mm-hmm. And then they might smoke a good Cuban cigar. And that's a potent vagal stimulus. Okay. And so then they feel like they're going to black out. So what we tell them is, keep in mind what can provoke this and try to avoid it.
Okay. And there's things that, there's actual techniques that I've heard, such as the body hug. Can you explain that?
Yeah, that's a great question. Obviously, there's a couple of environmental prophylaxis techniques that we tell the patients try to avoid it, but if it starts to happen, the first thing you want to do is protect yourself. You want to be able to get down on the floor if possible, put your feet up. That way you increase the venous return to your heart so that you get more blood flow going back to your heart and brain. And then one of the things that I do is I tell the patients to cross their legs and squeeze one foot against the other. And when you do that correctly, you're going to notice that you're lifting yourself up by contracting your gluteus, your buttocks muscles. And then they also wrap their arms together and they squeeze their arms. So you're basically squeezing your legs and your arms together, all the extremities, and forcing blood back into your central circulation until the episode resolves.
Wonderful. Are there any medications besides doing all these environmental prophylaxis and techniques that we can do to avoid having a syncopal episode?
There are medications. Before I get to that, I'd like to talk about one other technique. It's called guttural coughing, where you take a deep breath and cough hard to get a reflex going in your neck. And guttural coughing is not but really hard coughing so you can feel it going back into your neck. And a lot of times that'll actually prevent you from blacking out. As far as medications are concerned, yes, there are some medications that are effective. Sometimes we use medications called beta blockers. They block the beta receptors, leave the alpha receptors unopposed, and cause increase in tone and increased blood pressure. We also use salt tablets. You can salt load your food or take salt tablets, and that increases your blood volume and makes you retain more fluid so that these episodes don't happen. Sometimes we use antidepressants called SSRIs. Several have been studied. The classic would be Zoloft, but we can use Paxil. We can use a couple of different antidepressants, which also increase vagal tone by increasing serotonin in your brain. And then there are some specialty medications that are not easy to take, such as Proamidine, which can cause you to have goosebumps, but is effective in patients that are resistant to treatment.
And I know there's some correlation between syncope and having venous insufficiency. Can you explain that?
That's a great question. It's actually one that's under current research. But what happens with patients with venous insufficiency is that when they contract their vein column, the valve doesn't work. So the column still regurgitates. There's no valve to keep that column from falling back. So as a result, these patients, even if they have venous constriction, they can't keep that pressure column going back up to the heart. And with those patients, it's effective, as with a lot of patients with syncope, if they use compression valves, because that keeps pressure on the column from the outside.
Wonderful. Thank you so much for all that information.
Thank you, Joanna. Mm-hmm. Thank you.